Okay. Excellencies, distinguished participants, ladies and gentlemen, good morning and welcome. Thank you all for joining us today for this virtual side event at UNGA 75. My name is Stuart Simonson, and I am an Assistant Director General with the World Health Organization, responsible for the WHO Office at the United Nations. I will moderate today's side event titled Protraction of the COVID-19 Crisis, Mitigating the Impact and Protecting Future Generations. I want to acknowledge and thank the co-hosts of this event, the co-chairs of the Group of Friends Solidarity for Global Health Security, Canada, Denmark, the Republic of Korea, the Republic of Sierra Leone, and the State of Qatar. The Group of Friends of Solidarity for Global Health Security was launched on May 12th with the aim to provide a timely platform for UN member states to share their experiences and exchange views on how to effectively respond to the challenges posed by COVID-19. The group currently has 43 members and is engaged in various activities. WHO is fully supportive of this group, and we are grateful to the co-chairs for taking the initiative to form this group of friends. It is an especially important group of friends, and we look forward to working with them on COVID-19 and other health security issues. It is important, essential really, for the international community to come together to respond to the pandemic, but also to prepare for the next one. COVID-19 is not the only threat in nature's repertoire. But we cannot meaningfully prepare for the next pandemic unless we have achieved the SDGs. We have seen over the last several months how COVID-19 has changed the world as we knew it and created a different reality for all of us. Lives, livelihoods, economies, and societies have changed and changed forever. Everyone has felt this, regardless of where they live. It is proof positive how small our world is and how interconnected we are. This is especially the case for infectious disease, which knows no boundaries. I'm glad today's meeting is looking at the impact on future generations. While we are all vulnerable, youth are especially vulnerable as the pandemic comes at such a critical, formative time, when they are in the midst of learning, growing, and looking to begin the next stage of their lives. To make a better, healthier, safer world for youth, we need to substantially and permanently improve global health security. It has been said time and again, and well before COVID-19, the countries need to invest in building capacity to prevent, mitigate, and respond to infectious disease hazards, epidemics, pandemics. A year ago at UNGA 75, the independent Global Preparedness Monitoring Board warned of the looming threat of a pandemic, calling for global leaders to take urgent, united action to prepare. Earlier this week, the GPMB issued its 2020 report titled World in Disorder. The report looks at a world disoriented and disrupted by COVID-19. It calls for a renewed commitment to multilateralism and to the world's multilateral health agency, the World Health Organization. And WHO has in turn called on all peoples of the world and their leaders to support the 5 actions outlined in the GPMB 2020 report. 1, responsible leadership. 2, engaged citizenship. 3, strong, agile health systems and health security and sustained investment. 4, and 5, robust global governance of preparedness. Now, turning to the program, today's event will open with welcoming remarks from the ministers of the co-chair countries of the Group of Friends. These remarks will be followed by special messages from K-pop group BTS and Henrietta Fore, Executive Director of UNICEF. The video messages will be followed by a substantive session during which the panelists will discuss the impact of COVID-19 pandemic on future generations. The 4 panelists will focus their remarks on how to mitigate the actual and potential impact of the protraction of COVID-19 crisis, the role of new technologies in the private sector in responding to this crisis, and the needs and aspirations of the young generation. After the panel discussion, we will open the floor to member states for questions and comments. Delegates can take the floor by submitting their title and country using the chat function. We look forward to your engagement and a lively discussion. This side event is being live streamed on Facebook and UN Web TV. Finally, and importantly, I want to remind all participants to please make sure that your microphones are muted when you are not speaking. Now we will open the event with welcoming remarks from the ministers of the co-chair countries. First, we will hear the welcoming remarks of Minister Kang of the Republic of Korea.
Colleagues, Excellencies, distinguished guests, ladies and gentlemen, I'm very pleased to join this timely event hosted by the Group of Friends of Solidarity for Global Health Security. I would like to express my sincere thanks to my colleagues from the Friends Group member states and the experts for joining us in this virtual gathering. COVID-19 has been resurging in many countries, including Korea, even as we are struggling to deal with the fallout of the first wave. Globally, the number of daily new cases, well over 250,000, doesn't seem to have even peaked yet, and thousands of lives continue to be lost to the virus every day. There are hopes for vaccines, but the hopes are no answers to the intractable challenges made even more so by the pandemic around the world. Conflict resolution efforts on international, regional, and national levels have been sidelined. Hard-won development gains are being lost. Economies are going into recession, and global value chains have been disrupted. The humanitarian situation of the most vulnerable have worsened dramatically. The crisis has undercut the potential of the young to build a better future. Furthermore, the protracted crisis is weakening the will for mutual cooperation among countries to overcome this crisis together. COVID-19 has indeed exposed the vulnerabilities of the existing multilateral system. We have witnessed waning political leadership for coordinated global response as countries turned insular and closed borders. At the same time, the silent and fast-spreading virus has revealed just how interconnected we all are, and that collective action is necessary and urgent if humanity as a whole is to feel safe again. Furthermore, we must commit to do so for the long haul, as it is clear that COVID-19 is not going to be overcome anytime soon. Against this backdrop, I would like to highlight 3 key points that should guide our actions. First, we need to give real meaning and substance to the guiding values and principles of multilateralism and global solidarity. Viruses know no borders, and no country will be fully safe until the world as a whole is safely protected from this or any other novel virus that is likely to strike in the future. In addition to ongoing joint initiatives to mitigate the negative impact of COVID-19, making vaccines a global public good will be the crucial test of global solidarity. While the priority of each government is to protect its own people, we must pool our wisdom and resources together to ensure that all of humanity benefits from treatments and vaccines. And while addressing the immediate challenges posed by COVID-19, we need to strengthen the competency of the WHO and other multilateral institutions in preparation for future crises, and do so with clear-eyed realism rather than mere aspiration. The most urgent area for reform is the global health governance architecture, which needs to be strengthened to deliver concrete and immediate benefits to all members of humanity. In this regard, the independent review of the WHO and countries' responses to COVID-19, along with the updating of the international health regulations, will be instrumental and require the wholehearted support of all stakeholders. Second, we need to enhance social solidarity by ensuring that the most vulnerable and marginalized are given extra care and well protected. A community's resilience against crisis is only as strong as its weakest members. We need to capitalize on all available policy options to support populations that are most severely affected by crises, such as women, children, the elderly, persons with disabilities, and other disproportionately impacted. I also urge strong action against stigmatization, discrimination, and hate speech that engender divisiveness, distrust, and even violence. Third, we must do much more to strengthen intergenerational solidarity in overcoming the prolonged pandemic. Young people can play a significant role in re-energizing our community and promoting peace and prosperity. In this regard, I'm delighted that as part of today's event, we have a short video clip of the 7 young Korean men who are members of BTS. The power of BTS to inspire young and some old people around the world is truly amazing. The hopes they raise among the young must be matched by concerted government action to address the mounting challenges the younger generations face, such as deprived access to education, a harsher environment for economic activities, and fewer opportunities to incorporate their voices into the political process. Responsible social policies are inherently about the future and the young generation. COVID-19 has made them even more so. In the least, we must do our utmost to protect future generations from new viruses that may become pandemic. This means better preparedness of public health institutions built around global standards. And this makes the work of strengthening the WHO and upgrading the IHR all the more important. Ladies and gentlemen, like many others, Korea has also gone through a second wave of COVID-19. But thanks to our robust testing, tracing, and treatment capacity, we are well on our way to flattening this curve, just as we had the much higher curve in February and March. But the 3 T's are only the material manifestations of the principles that have guided the work, which are openness, transparency, civic participation, and innovativeness, which are the same principles that have won public trust in government action. And all along, we have engaged with the international community under these same principles to forge cooperation and trust. Instead of closing our borders, we have kept them as open as possible for essential international travel. We have fully shared our information and experience with the global community and have extended material and knowledge assistance to others. We are still going through ups and downs in the daily number of confirmed cases in varying scale around the globe, and the end of the tunnel seems to be still far away. But by staying connected and helping each other, we can move steadily toward a safer and healthier world. Korea is willing and ready to be an active participant in this journey, and I do hope that your discussions today will provide us with useful insights to transform this aspiration into reality. Thank you very much.
Distinguished colleagues, ladies and gentlemen, let me begin by expressing my sincere thanks to our partners from Korea and our other fellow co-chairs of the Group of Friends of Solidarity for Global Health Security for convening this important event. At a time like this, when every one of our nations and the lives of all people everywhere have been so profoundly affected by the still raging pandemic, global health security is in desperate need of more friends. The events of 2020 have taught us important lessons. For too long, we have downplayed the importance of global health security. For too long, too many people have paid too little attention to the potential for infectious diseases to disrupt and destabilize our interconnected world. They cited the rarity and relatively modest impact of recent pandemics to downplay the potential for a truly devastating global disease event. And now we have COVID-19. This pandemic has shown us how fragile we humans are, and it has exposed and magnified economic and social inequalities, weakened governments, and sparked civil unrest. It has caused suffering and ruthless disregard for those already marginalized and vulnerable. A virus that was unknown to science less than a year ago reminds us that disease can bring the world to a standstill, crippling economies, undermining geopolitical cohesion and security, and causing untold human suffering and loss of life. This pandemic makes clear the need for more collaboration to combat misinformation, builds capacity to prevent, detect, and respond to infectious disease threats, whether natural, accidental, or deliberate in origin. And therein lies the good news. We know what to do and how to do it. For example, for nearly 2 decades, Canada's Weapons Threat Reduction Program has been working to boost global health security by delivering capacity-building programming to mitigate biological threats. This work is part of Canada's contribution to the G7-led global partnership against the spread of weapons and materials of mass destruction. We are pleased and proud that programming implemented by Canada and other members of the 31-country global partnership is playing a decisive role in the global response to COVID-19. This includes biological laboratories that we have built and continue to support in Nigeria, Ghana, South Africa, Jordan, and the Caribbean, all of which are now testing for COVID-19, as well as an emergency operations center network in the ASEAN region. We have also forged strong and effective health security partnerships with many international and regional organizations, including the World Health Organization, the World Organization for Animal Health, and the Pan American Health Organization and Interpol. We are particularly proud of our longtime collaboration with Dr. Cameron Khan, founder of Blue Dot, who will speak later this morning. Global Affairs Canada has been working with Blue Dot since 2013 to develop and apply a customized analytic web application tool for disease surveillance in the ASEAN region, an application which has strengthened the ability of ASEAN nations to fight the current pandemic. This example reminds us that we have tools, both old and new, that can be used to give us the upper hand in the age-old battle against infectious diseases. What we need now is for more countries to engage and commit resources to a collective effort to strengthen global health security. Thank you. Merci.
I thank Minister Gould for her remarks and for her commitment and her government's commitment to multilateralism. Thank you. We will now hear from Minister Magnus Heunicke of Denmark.
Excellencies, dear friends of solidarity for global health security. COVID-19 has demonstrated the importance of international cooperation. It has taught us that we need to show solidarity and work together to tackle this global crisis. In the short run, we need to contain the virus and mitigate its immediate impact on our health systems, economies, and societies. Hopefully, in the coming months, we will have an effective vaccine and better treatment. But in the longer run, we also need to deal with recovery and preparedness for future health crises. In Denmark, once again, we are seeing an increase in cases of COVID-19. Many of the current restrictions are put in place to protect our elderly and vulnerable groups in society. And we ask young people to act in solidarity, even if we know that they might be the ones who pay the highest price for staying at home. Right now, we have the incentive, the attention, and the political will to strengthen our global health emergency preparedness. To repay the solidarity we are asking of our younger citizens, we have to look beyond the current crisis and focus on the longer-term solutions. We need to engage young people in shaping their own future as we recover from the crisis. In order to be ready for future health challenges, we need to strengthen our health systems, not least at primary level, to ensure access and improved quality of care. We need to continue to address the increasing health inequalities, promote mental health, and continue to fight for sexual and reproductive health and rights for all. Otherwise, we will not achieve universal health coverage, and our societies will be even more vulnerable to future health threats. How we respond, learn, and recover from the COVID-19 crisis will determine the world's ability to handle and prevent future health threats. One thing has already become very clear. Global preparedness and health security requires global commitment to international cooperation, now more than ever. Thank you for your attention. Stay safe. Stay safe.
I thank Minister Hynek for his remarks, and in particular, his statement about global preparedness. It cannot be said enough. So I appreciate his acknowledging that need. We will now hear from Minister Alpha T. Wuri of the Republic of Sierra Leone.
Good morning, all, and I must really thank you for giving me the opportunity to present Sierra Leone's position with regards to the protracted COVID-19 pandemic, but also maybe to present an issue that would be quite similar to other countries in Africa. May I express that a large number of countries had been exposed to civil war. Furthermore, in the Mano River Union in particular, we were unfortunate to experience the Ebola virus epidemic. This really had indicated what effects that could have in the health system, and in particular, what it could also have in the national economy. One thing we want to heighten is that as a consequence of the COVID-19, there are major societal changes. The lockdowns, the curfews indicates that we are not in a position as at yet to look at issues on mental health, issues on psychological disorders, issues on anxiety, issues of depression. So we see that there are a few other things to be able to look at in the health sector, apart from the fact that you could not access normal health facilities. We recognize that there was a downturn in accessing maternal and child care support, a downturn in accessing support for HIV/AIDS, a downturn in accessing support for malaria. Therefore, one has to reposition oneself such that whenever such epidemics or whenever such pandemics occur, countries would be better placed. So the very first instance, one would think that increased funding to the health sector is critical. The Abuja Declaration was talking about expenditures should be around 15% of the national expenditure. Most African countries have not been able to access up to that. It is critical that indeed all African countries work towards the full compliance of World Health Organization's joint external evaluation benchmarks. It is also critical that all African countries try to deliver on the international health regulations, all its aims and targets. These are supposed to be the baseline that would help, that would ensure that we are in a position to address whatever pandemics or even the occasional epidemics that we have to contend with. I mentioned earlier the issue of mental health. Really, policymakers should now see how we can expand mental health programs into communities, into schools in particular. There are not necessarily psychologists or psychiatrists, but a range of cadres of mental health professionals be trained to be able to go into that direction. Another main issue that one would consider is how do people continue to access services, drugs for HIV, drugs for malaria under such pandemic conditions. These are most critical issues in most African countries. Maybe one can take it sector by sector. In the education sector, we recognize that there's a whole change now. People will not be able to go to classrooms and go one-on-one linkage to teachers. How do we continue to access education using Zoom, using electronic means, even when you are out of the classroom, is something we have to handle. How do you do so when, in fact, you have to contend with mental processes, mental health issues as well? How do we improve psychosocial support in the school system to teacher training programs so they will be able to deal with such? In the agriculture sector, we notice that these lockdowns, these curfews, these restrictions cut down the people that go to farms, for low grade farming, which occurs in most our countries. You are dealing with actual people tilling the land. Maybe it is time now we try to see how we improve mechanization. So the time spent on the land would be short, yet the productivity would be just as high. It is critical because malnutrition seems to has reared its head, if not even to a stronger position during such pandemic, which our children that could be undernourished, malnourished, stunting is becoming critical. Therefore, their cognitive ability is also affected in many ways. These families are the small farmers that produces businesses, do some agro businesses that be able to earn something to support their children. When agriculture is affected, 60-70% of homes are indeed affected as well. So maybe one would consider that nowadays each home should be talking about backyard gardens. We have to practice doing that. Each school should be talking about school gardening. We should try to use the school garden in the school feeding program, whilst we try to improve mechanization in communities. Finally, may I consider the industries? Most African countries, manufacturing level is weak, is low. But even countries where manufacturing is high now have to be in a position to support us and provide drugs, for example. During this pandemic, we now know with the queue to procure drugs, each and every African country suffered in getting the right quantum and the right quality of drugs. Maybe this is now the time for us to recognize that each country has to be able to manufacture basic drugs that it really requires. Africa, I talked about African Medicine Agency, and now is the time we go for that. The total issue on this, I would say here, is that this pandemic should now let us know that the way we deal with ourselves have to be different. The way we organize our schools, our agriculture, our health sector have to be different. It is now time that we put insurance schemes in place to ensure, however weak your economic position, you can be in a position to get basic care within such difficult times. I thank you very much.
We are having some technical difficulties, and in particular with accessing UN Web TV. So, for those who were trying to use UN TV, please go to the Facebook page of the Ministry of Foreign Affairs of the Republic of Korea. You'll be able to access the session in real time through that site. And then once the session is over, we will upload the whole side event onto YouTube. And now we will take a we will not take a pause, and I will move on now to Minister Hanan Mohammed El Kwari of the State of Qatar. Minister?
Thank you very much. Your Excellencies, ladies and gentlemen, the State of Qatar is honored and pleased to co-host this important high-level side event on protraction of the COVID-19 crisis, mitigating the impacts and protecting future generations, together with Canada, Denmark, the Republic of Korea, and the Republic of Sierra Leone. This is a timely discussion taking place at a moment the COVID-19 pandemic has affected the entire world in a way we have never seen before. No region or country has been spared. The State of Qatar is concerned with the impact of the COVID-19 pandemic on the most vulnerable population groups, such as women and children, as well as the most vulnerable countries, including the least developed countries, landlocked developing countries, and small island developing states. We are deeply worried that the pandemic has created the largest disruption of education systems in history. The crisis is exacerbating pre-existing education disparities by reducing the opportunities for many children and youth to continue their learning. In this regard, the COVID-19 pandemic is not only a global health crisis, but also a humanitarian, human development, and economic crisis. Robust global cooperation is essential. We must work together. There should be only one fight in the world today, a shared battle against COVID-19 to mitigate its impact and protect future generations. As we celebrate the 75th anniversary of the United Nations, COVID-19 is a strong reminder of the essential need for effective multilateral cooperation to protect the well-being of individuals and societies. Only by acting in solidarity and by strengthening international cooperation can we overcome this threat to us all, enable the most vulnerable to respond and recover, and to build back better. His Highness the Emir of the State of Qatar's deep belief in global solidarity has been translated in Qatar's growing support to international action on several fronts. We have contributed $20 million to the World Vaccine Alliance to accelerate the development and production of a vaccine, and we have allocated $10 million for the World Health Organization to support equipment, diagnostic, and therapeutics for COVID-19 and equitable distribution of vaccines to everyone who needs them worldwide. These are concrete steps that we have undertaken to save lives and leave no one behind. We have also provided urgent medical assistance to dozens of countries around the world, amounting to nearly $89 million. Furthermore, as a consequence of our deep commitment to SIDs, LDCs, and LLDCs, we are pleased to be hosting the upcoming 5th UN Conference on LDCs in Doha, scheduled to take place on the 23rd to 27th of January 2022. In this occasion, the LDC's program of action for the next 10 years will be adopted. Your Excellencies, ladies and gentlemen, in conclusion, I would like to reaffirm the determination of the State of Qatar to support the United Nations in building a future of peace and prosperity for all, leaving no one behind in a world free of COVID-19. Thank you very much.
Thank you for your comments, Minister Al-Kawari. And indeed, I'm grateful to all ministers for their valuable time and their welcoming remarks. Before we go to the video from BTS and Henrietta Fore, we will want to remind you to access this session through the Ministry of Foreign Affairs, Republic of Korea Facebook site. It's live streaming there, and you'll be able to watch it in real time. And as I said earlier, we will download this or upload this to YouTube. So now we will hear a special video message from the Bangtan Boys and Henrietta Fore. Executive Director of UNICEF. I don't know what.
Stuart, would you like me to say a few words before we see the video? Perhaps I should just begin, Stuart? All right. I'm going to think that, Stuart, you're saying yes. So, Excellencies, distinguished guests, ladies and gentlemen, on behalf of everyone at UNICEF, our thanks to the Government of Korea and the group of friends for hosting this discussion at such an important moment. And of course, our thanks to BTS for their continued personal support to UNICEF. Their powerful voices are encouraging millions of children and young people who are feeling anxious and isolated to speak out and to support each other in these extraordinary times. They remind us all that we must unite and join forces not only to address the pandemic, but to build stronger, more sustainable systems for the future. Because even before the pandemic hit, the world was off track in meeting the Sustainable Development Goals. And now COVID-19 has exacerbated the lingering inequalities in all of the systems that support people's lives, threatening to reverse decades of progress made in health, nutrition, education, and poverty reduction. As we scale up our immediate response, thanks to generous donors like you, we are also helping countries strengthen their systems for the future. We're putting a particular emphasis on 4 key areas, all of which require new partnerships with the public and private sectors as we help communities respond, recover, and reimagine systems for the future. So first, distance learning to save futures. We've joined forces with Microsoft and Cambridge University to put education and quality learning in the hands of every child and young person through the Learning Passport. It's an online platform that gives children and youth access to their school curriculum online, wherever they are, including textbooks and instructions in their national language. Over 227 million children are now being supported, and we're working with more companies to develop even more innovative learning systems and solutions. We're also working with public and private partners around our GIGA initiative to expand internet access to every child in every community and every school by 2030, a chance to provide not only education, but also skills and training for young people to enter the workforce. Second, we're focused on water to save communities. In addition to delivering immediate water, sanitation, and hygiene supplies to communities dealing with the pandemic, we're working shoulder to shoulder with governments as they invest in stronger water infrastructure for the future. Businesses are joining our work. They're stepping up with offers of funding and contributions in kind Unilever and Colgate-Palmolive have generously contributed soap and other hygiene products. They're helping us strengthen and speed up the supply chains for critical items like soap and sanitizer. And they're helping us scale up innovations for communities in need. Through our partnership with Lixil, for example, we have designed a low-cost, low-water flow hand-washing device that can help more households fulfill this basic need. And we have launched an initiative with the World Economic Forum, WHO, and the World Bank to gather more partners, ideas, and funding around the need for greater hygiene. We also want to bring public and private financing together to invest in stronger water systems in the poorest and most disadvantaged communities, not only as a basic need, but as an essential disease prevention measure. It includes a blended finance initiative with a pipeline of projects under development worth more than $500 million. And third, we're working on mental health to save families. As I will mention in the video, COVID-19 and the measures put in place to contain it have been particularly challenging for children, adolescents, and young people. Schools closed, health services stretched, counseling and psychosocial support being lost, isolation and being cut off from friends. These are all having an impact on the mental health of young people. In response, UNICEF has been scaling up mental health support and counseling for children and adolescents to help them through this uncertain time. And our fourth and last area of focus is immunization to save lives. This includes supporting the ACT Accelerator Initiative to develop and deploy innovative new diagnostics treatment tools like oxygen therapies. UNICEF is also playing a lead role in the COVAX facility to ensure that any vaccine delivered is fairly and equitably distributed around the world. This could become one of the largest procurements of vaccines in history, and we look forward to working with the public and private sectors to manage the supply chains for these vital vaccines. Throughout this work, we're helping countries strengthen primary healthcare services and bring them closer to where people live, something we are doing with you, Stuart and Tedros, in WHO. We are supporting more than 115 governments as they scale up social protection measures to address socioeconomic impacts of COVID-19. Throughout all this work, UNICEF is proud to be working with all of your governments and with a group of friends. While the pandemic has changed our lives, it has not dimmed our commitment to serve and support children. So thank you all for your continued support and for your commitment to children and young people everywhere. Thank you, Stuart, and I turn you back over to the video.
Thank you. Thank you, Henrietta. I have to say that really was an inspiring statement. And it shows the breadth and depth of the work that UNICEF is doing and the many partnerships you have. And I also want to thank you on behalf of my colleagues in Geneva and around the world for all of the support that we get from UNICEF. It is a model partnership, and we're very grateful for it.
Thank you, Stuart.
So now we will go to the special video message from the Bangtan Boys and Henrietta Fore, who will be in this video as well.
Hi, I'm Henrietta Fore, Executive Director of UNICEF. I know this year has been hard on young people. Your lives have been turned upside down. What seemed normal and familiar is now strange and new. And what you're feeling is probably hard to explain. Things might not feel right now, but we can use this time to think about how we can reimagine and build a better world. You are not alone. I hear you. And I know our friends BTS hear you.
Thank you, representatives of the member states of Group of Friends of Solidarity, for Global Health Security, UNICEF Executive Director, Excellencies, and distinguished guests from all around the world. It is a great honor for us to have this valuable opportunity to speak in a session in the 75th UN General Assembly. My name is RM, the leader of the group BTS. And 2 years ago here, I asked your name. I urged you to let me hear your voice. And I let myself be filled with imagination. As a boy from the small city of Ilsan in Korea, as a young man standing at the UNGA, as a global citizen of this world, I imagine the limitless possibilities before all of us, and my heart beat with excitement. But COVID-19 was beyond my imagination. Our world tour was totally canceled. All of our plans went away, and I became alone. I looked up but couldn't see the stars at night.
절망했습니다. 모든 게 무너진 것만 같았습니다. 할 수 있는 건 창밖을 내다보는 것뿐이었고 갈 수 있는 곳은 제 방 안뿐이었습니다. 어제는 전 세계 팬분들과 함께 춤추고 노래했었는데 오늘은 내 세계가 방 하나로 줄어든 것만 같았습니다. 그때 저의 동료들이 손을 잡아주었습니다. 함께 토닥이며 무엇을 같이 할 수 있을까 이야기를 나눴습니다.
오랜만에 어쩌면 데뷔 후 처음으로 일상이 찾아왔습니다. 원했던 건 아니었지만 소중한 시간이었습니다. 넓었던 세계가 순식간에 좁아지는 건 제게 굉장히 익숙한 경험입니다. 월드 투어를 하면서 화려한 조명과 팬분들 환호 속에 서 있다가 그날 밤 방으로 돌아오면 제 세계는 겨우 몇 평짜리 좁은 공간으로 변하기 때문이죠. 좁은 방 안이었지만 나와 우리의 세계는 넓게 펼쳐져 있었습니다. 악기와 스마트폰 그리고 팬들이 그 세상 안에 존재했기 때문이죠.
그런데 이번엔 예전과 달리 더 외롭고 좁게 느껴졌습니다. 왜일까? 한참을 생각했습니다. 아마도 상상하는 것이 힘들어졌기 때문이 아닐까 생각했습니다. 지금의 상황이 많이 답답하고 우울해졌지만 메모를 하고 노래를 만들며 나에 대해 돌아보기도 했습니다. 여기서 포기하면 내 인생의 주인공이 아니지. 멋진 사람은 이렇게 하겠지? 라고 생각하면서요.
누가 먼저였는지는 모르겠습니다. 많은 감정을 끌어안고 우리 7 멤버들은 함께 음악을 만들기 시작했습니다. 그렇게 시작한 음악이기에 모든 것에 솔직할 수 있었고요. 우리의 삶은 예측할 수 없는 만큼 정해진 답도 없습니다. 저 또한 방향만 있고 뚜렷한 방식은 없는 상태에서 나와 우리를 믿으며 최선을 다하고 순간을 즐기며 이 자리까지 왔으니까요.
우리의 음악과 함께 사랑하는 멤버들과 가족, 친구들, 그동안 잊고 지냈던 나를 찾았습니다. 미래에 대한 걱정, 끊임없는 노력 다 중요하지만 가장 중요한 건 자기 자신을 아껴주고 격려해주고 가장 즐겁게 해주는 일입니다. 모든 게 불확실한 세상일수록 항상 나, 너, 그리고 우리의 소중함을 잃지 말아야 합니다. 저희가 지난 3년간 이야기해온 Love Myself 메시지처럼 그리고 I'm Diamond, You know I glow up 이란 저희의 노래 다이너마이트의 가사처럼 말이죠.
모두 함께 작업하던 어느 밤 RM 형은 별이 보이지 않는다고 했는데 그때 제게 유리창에 비친 제 얼굴이 보였습니다. 우리 모두의 얼굴도 보였습니다. 그렇게 서로에게 들려주고 싶은 이야기를 노래로 만들었습니다. 불확실한 오늘을 살고 있지만 사실 변한 건 없습니다. 내가 할 수 있는 것이 있다면, 우리의 목소리로 많은 사람들에게 힘을 줄 수 있다면 우린 그러길 원하고 계속 움직일 것입니다.
When I start feeling lost, I remember my face in the window, like Jungkook said. I remember the words I spoke here 2 years ago. Love yourself, speak yourself. Now, more than ever, we must try to remember who we are and face who we are. We must try to love ourselves and imagine the future. BTS will be there with you. Our tomorrow may be dark, painful, difficult, and we might stumble or fall down. But the stars shine brightest when the night is darkest. And if the stars are hidden, we'll let moonlight guide us. If even the moon is dark, let our faces be the light that helps us find our way. Let's reimagine our world. We're huddled together, tired, but let's dream again. Let's dream about a future when our words can break out of our small rooms again. It might feel like it's always night and we'll always be alone, but the night is always darkest before the first light of dawn.
Life goes on.
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 Let's
live on.
Executive Director of UN Women, and Ms. Stine Bang Larsen, Youth Delegate of Denmark. Thanks so much to all of you for being with us today. As noted earlier, we will have an opportunity for Q&A and open discussion with panelists following the session. A reminder to member states wishing to take the floor during the discussion, please submit your title and country name using the chat function. I would like to start with Dr. Kamran Khan of Blue Dot to discuss the new and innovative technologies that are being developed by the private sector in response to the new normal created by COVID-19. I mean, in some ways, it is the silver lining in this awful cloud, the tremendous acceleration of innovation and emerging technologies that will change our lives forever in a good way. And it would be good to hear your insights and thoughts on that, Dr. Khan. The floor is yours.
Thank you, Mr. Simonson, and thank you very much for inviting me to be a part of this really important discussion today on preventing and mitigating some of the impacts from COVID-19, but also about protecting future generations. If I may, I'd actually like to start out just by speaking a little bit to the issue of protecting future generations. You know, there's an adage that I think many of us have heard, which is those who cannot remember the past are condemned to repeat it. Now, 18 years ago, I started my career as an infectious disease physician. I still practice as a physician. And a virus that nobody had ever seen or heard of before showed up in our city here in Toronto in Canada, infected a colleague of mine, led to the deaths of other healthcare workers on the front lines, and really crippled our city for 4 very long months. Of course, that outbreak was SARS-CoV. And here we are, 18 years later, now dealing with SARS-CoV-2, which has now triggered a pandemic that, of course, is much larger in scale and in impact. And there have been other outbreaks that we have had to deal with. The Zika outbreak in 2016, there was an outbreak of MERS in South Korea in 2015, the Ebola outbreak in West Africa in 2014, the H1N1 pandemic in 2009. We are in a cycle, and we are continuing to repeat this cycle, unfortunately. One of the key messages I think that perhaps we can take away from this pandemic is that almost all of these outbreaks that we have encountered, what they have in common is that they have started from viruses that originated in animal populations and made their way over to human populations, again, with profound health and economic and social consequences. So we are stuck in a bit of this cycle, and an important lesson as we think about our youth and protecting future generations is that our health and our security is linked to the health of other living systems on our planet. And this will be, I think, an important lesson, so we don't just get focused on how do we get ourselves out of COVID-19, but how do we help prevent ourselves from getting ourselves into the next pandemic. So in the meantime, we are, of course, dealing with a growing number of infectious disease threats, and we're seeing them increase in frequency and scale and in consequence. What we've learned from COVID-19 is that outbreaks and pandemics spread incredibly quickly. And if we are going to stay a step ahead of them, we're going to have to move even faster. Now, thankfully, we have a lot of the raw materials needed to do that. We have growing access to data. We have advanced analytics like artificial intelligence and machine learning, and the latest innovations in digital and information technologies to be able to literally spread knowledge around the world faster than these outbreaks can spread. And this has largely been my life's mission as a practicing physician, as a professor who's been studying outbreaks my entire professional life, and then more recently as the founder and CEO of a digital health company called Blue Dot. And we've been building for the last 7 years, well before COVID-19, a global early warning system for epidemics. Now, turning data into insights is just half the battle, and turning insights into action is what we have to do. And that, of course, requires partnerships. We have had the privilege of working with the Government of Canada for many years, as you heard earlier, with the Association of Southeast Asian Nations and with a growing number of countries around the world. What this really reveals is that the problems we are confronting are too challenging for government alone to solve, or for academia alone to solve, or civil society, or the private sector. But ultimately, it is these types of public-private partnerships that can help us really build lasting resilience against the inevitable infectious disease threats that we will face again in the future. So again, thank you for inviting me to be a part of this important discussion today. I'll turn it back to you.
Thank you, Dr. Khan. I would like to ask our next speaker to talk about how COVID-19 is disproportionately impacting women and girls, and especially the most vulnerable in the most vulnerable situation. Ms. Regner, can you focus on this and the work UN Women is doing to respond to the pandemic, including coordination with other UN agencies? I can't hear you.
You hear me?
Well, we'll go to. Oh, I'm sorry. I'm sorry, Ms. Stegner. I got the order mixed up. We will go instead to. Okay. Just maybe also if you would just proceed and.
Of course, and you hear me too, so that's good. So, well, thank you for having me, and thank you, co-chairs, the government of Korea, and friends of this initiative. Yes, thanks for the opportunity to reflect on what COVID has meant from a gender perspective, and also something about what we can do about it. I think that we all see that women, including young women, some of them had their first work-life experience during this pandemic. And I think we have all seen that women have literally saved the lives of the rest of us during the pandemic. And they continue to do that so through their professionalism, their dedication, their knowledge, their experience. They go to work every day and they continue day after day after day after day. However, we know that many of these jobs in the health sector, in the elderly care, in the agriculture sector, in grocery stores, in pharmacies, are not paid and not valued on the same level as corresponding traditional male jobs are. We still have a gender pay gap. And I think that if we want to attract a young generation, young women and young men to come into these now currently women-dominated areas of the labor market, I think we have to do something about this. This is important from a women's and girls' point of view. I think that women and girls, women and young women really have shown leadership here. And I think that we have to show that we have understood and seen how important these jobs are to society. I think we have a lesson here, and I think it's very, very important for future societies that young people, both women and men, want to choose these kinds of professions. Another reflection I have is on violence. We know that violence has been increasing during the pandemic. We estimate, unfortunately, around 20 to 30% during the pandemic, and that is male partners' violence against their women that they live with or are partners with. This also means that a lot of children, both girls and boys, have witnessed this violence and sometimes also been victims of the violence. The Secretary General very early during the pandemic made an appeal in order for member states to do more to prevent the violence. We can now see 5-6 months later that many member states, 140, answered the appeal, and they have also put measures in place. However, they were unfortunately too ad hoc, and they were also underfunded. This is a pattern we see when it comes to gender equality in general, and that is something I think we also together need to work more on. And obviously, UN Women is doing that in all the countries where we work. That is also true for economic empowerment that I talked about earlier. And we have been also working together with the rest of the UN system and continue to do so to put pressure on governments to do more and also mitigate, not least in conflict zones where the violence has increased the most. I think also another point that I know Henrietta is very close to Henrietta and UNICEF's heart, and that is to do whatever we can so that girls return to school to the same extent as boys after confinement, and because we know that there is a bigger risk that girls are subject to child marriage or other harmful traditions, or that they are stuck being obliged to do care work for others, for example. And I think a big important effort for all of us needs to be to do whatever we can so that girls return to school. In order to do this on a more long-term basis, we need to involve girls and young women's organizations and in the future shaping, not least of gender equality policies. Civil society and not least young civil society groups should not only be involved, they should lead the shaping and designing of future policies. From UN Women's side, to conclude, this is the year 2020, 25 years after the Beijing platform, which came out with the only international action plan for gender equality. So 25 years after the Beijing meeting, we see that there has been gains in gender equality, not least on girls' education and also on maternal, to reduce maternal mortality. But we see, as I said before, that although a lot of good legislation and reforms have been put in place, which is positive, they are not and they are underfinanced. So when we go further and identify the areas, violence, economy, sexual and reproductive health and rights, and new technologies, environmental issues, and decision-making as such, we need young girls, young women, but also boys and men to be a vital part of the shaping of those measures. Thank you.
Thank you very much, Ms. Regner. I would like now to turn to Ms. Larsen, Youth Delegate of Denmark, to discuss the special needs and aspirations of young people in the context of the pandemic. Ms. Larsen, the floor is yours.
Thank you, and thank you to the group of Friends of Solidarity for Global Health and Security for inviting me today to speak on the behalf of the youth. As we all know, the COVID-19 have impacted our lives, and it has especially impacted the young people. It has especially impacted in the way we are employed, in our education, in our mental well-being, and our rights. And we all know that the youth have been impacted, but we also need to acknowledge that the young people have been affected differently. We see that young women have been more affected than young men, and we see that the impact has been more significant on youth in low and middle income countries than for those in high income countries. What we see is that education and schools have been closed, but we also see that not all young people have been able to transition into online and distant learning. 1 in 8 young people are without access to courses, training, and teaching. And this is a problem because education is one of our human rights, and all young people should be able to get an education. And for those who have been able to transition into school, we see that distant learning is a kind of a problem because 56% of young people have reported that they have learned less because of the pandemic. 51% of them have also believed that their education will be delayed, or even 9% of them will say that they will fail this course or the education. When it comes to employment, we also see that a lot of the young people have lost their jobs after COVID-19. We see that 1 in 6 young people are without work anymore. And we even see a quite big reduction in their income. 2 out of 4 young people have received a reduction in their income. And we see that young women have reported greater loss in their income than young men have. Young people whose education or work have been disrupted have led to a new health crisis. We see that 71% of young people are probably affected by anxiety and depression due to the lack of education and work. And this is a big crisis when it comes to mental health. We need to focus on how we can make sure that the health of the young people will go back to normal. We also see that due to the pandemic crisis, we see a decline in human rights. This includes exercising the right to education, affordable householding, health services, including for mental health, services participation, as well as the right to work. We know that everyone is entitled to the human rights, irrespective of the nationality, gender, the race, the religion, or ethnic background, or any status. Some group of people, including young people, are especially young women, face more barriers than others to access their rights. We see that the COVID-19 have widened the gap between the most privileged and the least privileged youth, who all have different tools to get through the crisis. Therefore, COVID-19 have made the inequality between young people bigger. And this is especially going to impact the future that we are going to make for ourselves to build a better world. And the way to reduce the inequality between young people is one of the things we can do is to try to minimize the gap between young people who have not been able to have technology to transition into online school and learning. We need to look at the human rights and restore the human rights we have seen been declined under COVID-19. The restriction on civil rights and the restriction of civil society must be withdrawn. We also need to promote sexual and reproductive health and rights. COVID-19 requires us to reflect on our way of living together and our life, but it also shows that we need to work together, not only for getting through the crisis, but also to obtain the Sustainable Development Goals for a better future. If we want to build a better world after COVID-19, young people have the rights to participate in the decision-making process that affect them. It also means that young people must be consulted in the reconstruction after COVID-19, also when it comes to the economy, because it is our generation which hits the hardest, and it's our generation that's going to live with the consequences of our decision in the future. Thank you very much.
Thank you, Ms. Larson, and thanks to all of our panelists for sharing their views and insights. It was very interesting, and I think sets the context, the tone for the next segment of our side event, the discussion and the Q&A. As the panelists have indicated, we need an all-of-society approach to responding to this pandemic and preparing for the next. This cannot be done, it seems to me, without achieving the SDGs. That is the condition precedent to preparing for the next pandemic. I think it's very clear now, if it wasn't before, that the SDGs are not a luxury, but an imperative. And achieving the SDGs benefits everyone, not just the poorest and the most vulnerable, everyone. This pandemic has made the case definitively that we are only as safe as the least safe person on the planet. This is, I think, the overarching lesson that COVID-19 has taught us, or is trying to teach us. So now we will begin with the Q&A segment. I will give the floor to the five delegates at a time. Then we will hear responses from the panelists. In the interest of time, I would like to ask you to limit your comments and questions to absolutely no more than 2 minutes. I have on the screen the permanent representative of Canada, Ambassador Ray, the permanent representative of Sierra Leone, Ambassador Kaba, the permanent representative of the Republic of Korea, Ambassador Cho, and the deputy permanent representative of Germany, Ambassador Soter, and the Director General of the Ministry of Foreign Affairs of Turkey, Ambassador Sen. So why don't we go first to Ambassador Ray.
Thank you very much. Thank you for the opportunity to join you. I think it's an important moment in history at the moment. We're about to enter, in many countries, about to enter a second phase. And I think that's what leads us to share a profound concern about not only the health impacts of the second phase, but also the ongoing economic and social impacts, which a lot of our guests have talked about. And I have to say that I think Canadians attach a great deal of importance to this, and so do people around the world. It's something that we share in common. But it strikes me that COVID is not so much an equalizer as it is a revealer. It's not a leveler. We're all in it together, but I think, as many of our panelists have noted, we're in it in a different way. And I guess the question is, how do we, in a time of increased nationalism and the increasing expression of self-interest, how do we create the solidarity necessary to deal with the extent of this crisis? Seems to me that's the essential political challenge that we're facing now. Secretary General yesterday said, solidarity is self-interest, which I agree with. But I think the question is, how do we get this notion more widely shared?
Thank you, Ambassador. Ambassador Kaba?
Time like this, it is very vital.
Okay.
Oh, sorry. Let me. Can you hear me now?
We can hear you, yes.
Okay. I'm sorry. Yeah. Okay, well, thank you very much, moderator. I want to thank all the co-chair in our countries for collective commitment to the pursuit of global health security, especially at this point in time. And I think it is clear to all of us that we need inclusive multilateralism to get through this. That this is not a time for us to engage in narrow nationalism, whether in the pursuit of the vaccine or beyond. And that it's very clear that when there's global solidarity, we're able to overcome great obstacles. As a country, Sierra Leone, which suffered from Ebola, it is very clear that it was international solidarity, global focus on helping Sierra Leone, Guinea, Liberia, the Mano River Union area that made it easier for us to overcome. And today, having rebuilt our economies, we are faced with another pandemic. It is clear that the kind of lessons we learned from Sierra Leone, which is that we need to build resiliency. We need to invest in communities. We have to make sure that education, and especially girl child education, and making sure that we provide resources for targeted communities, it's the key. Otherwise, we'll find ourselves confronted with a major threat to global peace and security in the near future. And so the question really for all of us here and for the panelists is, how do we make sure that lessons we learned from dealing with, say, Ebola, the kind of international solidarity is not lost at this point in time? Thank you very much.
Thank you, Ambassador. Ambassador Cho?
Yes, thank you very much, Mr. Simonson. As Foreign Minister Kang Kyung-hwa has made all the points Korea wants to share with you today, let me just introduce what was announced by President Moon Jae-in of Korea in the General Assembly Hall yesterday. In the general debate of the General Assembly,
Another panel.
President Moon proposed to launch a Northeast Asia cooperative initiative for infectious disease control and public health, inviting North Korea to participate as a member along with China, Japan, Mongolia, and the Republic of Korea. I'm convinced that this architecture will enhance the public health in the region. But more importantly, this initiative will contribute to the peace and security in Northeast Asia. Why? Because, as pointed out by previous speakers, we can overcome the exuberance, too much of nationalism by making a collaborative architecture here in Northeast Asia. So the COVID-19 crisis has clearly showed us how closely the world is interconnected. And we have realized the importance of solidarity and multilateral cooperation. In this regard, I would like to ask this group, the strong support for the initiative made by President Moon yesterday. Thank you.
Thank you, Ambassador. Ambassador Sutter?
Thank you very much. First of all, I wanted to congratulate Henrietta for this fantastic cooperation with BTS. I thought it was really marvelous. I just sent a screenshot to my daughter, who is a big BTS fan. Her name is Anna, and she was really fascinated by that. So thanks a lot for that. I would like to make two very brief points. One is on an aspect that colleagues have not yet touched upon. That is pandemic preparedness. We believe we have to think beyond the current crisis whilst dealing with it. And when we speak about preparedness, the World Health Organization certainly has to be at the core of that. But we all carry a collective responsibility to ensure that it does have the ability to fully fulfill its mandate. In this context, we have presented, together with colleagues from France, a non-paper on strengthening the World Health Organization's leading and coordinating role in global health in Geneva. And we find that this is an important thing to follow up on. My second point is of a general nature. It's about the spirit of cooperation that we need vis-à-vis COVID. This is a virus. It does not care about nationalities. It does not care about ethnicity, gender, religion, sexual orientation. It menaces all of us. And therefore, we truly believe that there is no alternative to a truly multilateral approach. Now, during the General Assembly, we hear a lot of solemn words about multilateralism, but COVID really puts that to a test, and it's very important that we stand that test. We will only overcome this together because we are in this together. Thank you.
Thank you, Ambassador. Ambassador Sen.
Thank you very much indeed. I'd like to thank also the co-chairs of the groups of Friends of Solidarity for Global Health Security, namely Canada, Denmark, Korea, Sierra Leone, and the State of Qatar, least but not the least, last but not the least. I just want to make also a few points. One is that Turkey is extremely engaged with the issues surrounding the youth. We are hosting the Islamic Youth Forum for Cooperation, for example, and also we intend to host and we hope to host the UN Youth Center. And I think that this theme is extremely relevant in this context. The first thing that I have to say is that this pandemic actually, as the UN reports indicated, have disproportionately affected the elderly, the children, and the youth, who have been actually subject to several forms of inevitable restrictions and lockdowns. And in addition to that, they have been away from the education that they duly require. As Turkey, we have been doing our best to socially support them and then to put in place necessary infrastructure. Of course, as Turkey, we are fully committed to the international cooperation and solidarity. And then by extending medical assistance to 152 countries, we have been doing our best, and they will continue to extend to the best of our capacity our assistance to further countries. Medical equipment assistance, training in tackling the pandemic, and all other financial assistance and all other possible forms of pandemic. It goes without saying that we require international cooperation assistance to each other, and then for the future generations, young generations, as the UN reports actually have put out, the world at risk, the world in disorder. We appreciate those reports, by the way, highly. We have not prepared for this pandemic. And then what we owe to the future young generations is that we must have learned our lessons, and it's high time that we actually put in place necessary international cooperation mechanisms so that we are prepared for the next pandemic. I think that is the most important task at hand. And then we rely on a strengthened multilateral system, UN system, World Health Organization, efficient and effective WHO, to really prepare as international community, as states and international organizations for the future pandemic. Thank you very much indeed.
Thank you for those questions, comments. We'll now turn it over to the panel and ask them, because we're running short on time, to respond in not more than 1 minute each. So we'll start with Dr. Khan.
Thank you for all those questions. Recognizing time is short, let me just echo the sentiment that I think we need to be looking past this pandemic. Completely agree with that. And I feel as though, as someone who has experienced a coronavirus outbreak 18 years ago, that we are seeing this cycle happen again. Our memories, unfortunately, are very short. And the question for us is whether or not we will be able to maintain the same level of vigor in peacetime as we are during the midst of this crisis. And that will be our challenge. I do think it is very important for us, and I say this as a physician who knows that prevention is a hard sell. I can often deal with mitigating impacts from an illness in my patient, but getting my patients to take proactive steps to prevent an illness in the first place can be very difficult. What I would like to say is if we do not think about where these types of pandemics are originating, we will be continuously firefighting. And I think what we need to also be doing is thinking about fire prevention. So I will turn it back to you.
Dr. Khan. Ms. Regner?
Very much. It stuck, the comment from the representative from Sierra Leone stuck with me on what we can learn from other outbreaks of pandemics. And when it comes to violence against women, we knew already then that happened during confinement. However, not a lot was actually, this issue did not attract a lot of attention and was not seen to the same extent as now as part of response. But now I think, although I said before that the measures were too ad hoc and underfunded and the violence is spiking now as well, we did learn to at least take these actions, and it has been and is on the political agenda as an important issue. So I think that is an example of something that society learned, which is really important for women's safety. However, we need to do even better. So in shaping a new future coming out of the pandemic, we have to take women's lives in its totality into account. And I come back to the issue of economic empowerment and independence. And these two issues are very linked. Only when women have decent work, decent payment, and when equal pay is actually a reality, can women decide freely about their own lives and also leave abusive relationships when they have to. One example. Thank you.
Thank you. Ms. Stein?
Thank you. I will say that from this crisis, we should learn that we all are going to be involved and we are all in like this. It is important that not only all young people, but all people will take this into consideration afterwards. We need to look not only at ourselves, but at our friends and our and all the other people around the world, because we are in a society where globalization is a very big thing. I think that from my perspective, I will say that we need to, when looking on and looking into the future of this, we need to look in and take into account what the young people have been experiencing from this, and they also need to take this into consideration when preparing for maybe the next pandemic also. Thank you.
Okay. So we have reached the end of our time and will not be able to accommodate any further questions. As I previously announced, the entire event will be uploaded on the social media sites, including the Facebook page of the Ministry of Foreign Affairs of the Republic of Korea. Finally, let me thank the participants and panelists and the co-chairs for organizing this event, and I especially want to thank them for asking me to be the moderator. I appreciated that, and I look forward to further collaboration with the group of friends. Let's hope this provocative and I think well-informed discussion continues during UNGA 75 and beyond. This concludes our side event. Thank you very much. Okay.